Hello everyone, I'm Tony and we are Group 3 and today we are going to talk about the medical industry and the company we selected to interview is called Tricol Biomedical Company and which is Oregon based and the Tricol Biomedical Company formerly known as Hemcom Medical Technologies and it is a world leader company that develops hemostasis and infection control products. And these products provide bleeding control solutions and wound care management tools for medical practitioners. And their products are intended to professional medical, surgical, trauma, military, and customers over the counter applications. And in 2016, the Tricol Biomedical, under the directives of the Tricol International Group, acquired the Hemcom Medical Technologies and all associated brand names. The company provides military, emergency, and trauma, EMS, dental, wound care, and wellness medicine solutions. They also they serve their customers through a network of distributors in the United States and the rest of the world. And then I will talk about the problems in this industry. As we all know, the medical industry is strictly regulated by government. And the regulatory compliance is noted as one of the top three challenges in medical device manufacturing in 2017. And the FDA Center for Devices and Radiological Health is responsible for regulating firms who manufacture, package, and import medical devices in the United States. And basic regulation requirements include establishment, registration, medical device delisting, pre-market notification, and the approval, quality system regulation, labeling the requirements, and the medical device reporting. Additionally, because of the term medical device can refer to a large area of product, the FDA has separate or differing the regulations for each product. As government regulation are especially become a rising burden regarding quality assurance, reinforcing the importance of operational excellence in the supply chain. And the other hurdles found in medical device logistics include visibility issues and IT infrastructure that should provide for this visibility, as well as differentiation in the methods of delivery that customers demand. Because of the additional services requested upon delivery, the distribution management has become a source of competitive advantage. Okay, and then my teammate will talk about more about the SWOT analysis in this industry, and Jerome will give more details about this company, and we'll give at the end we'll give our recommendation.
And so next, I am going to talk about the market size of the U.S. medical device industry. So the United States is the largest medical device market in the world, with a market size of about 148 billion, and is expected to reach 155 billion in 2017. In 2015, the U.S. market value represented about 43% of the global medical device market. And the exports of medical devices identified by the Department of Commerce exceeded 44 billion in 2015. There are more than 6,500 medical companies in the U.S., most of which are small and medium-sized enterprises. Additionally, in 2015, the global hemostasis product market value is approximately 5.3 billion US dollars, and it is expected the global market will reach approximately 6.7 billion in 2012, with annual compound growth rate around 4% between 2016 and 2021. So next, Finn and Nathan are going to talk about the SWOT analysis of the medical device industry.
All right, Nathan. Okay, thank you, Rupa. So now we're gonna go on the SWOT analysis. So first, I want to go off on strength. So since Rupa mentioned about the market, so I want to go on saying that about the market position and size that United States kind of lead in the role of the medical device market, and also U.S. company account for 2/3 of the total revenue, which accommodate from the top 40 medical device companies. So you can see there's some growing economics in both Asia and Africa. So it's kind of showing the potential of high regard of the brand recognition and reputation among American company. So that leads to some of the kind of supportive to academic institution because there are around 141 accredited medical school. Medical school. Approximately also there are 400 major teaching hospital and health system located in the U.S. And there are many academic institutions partner with medical device company. So they are focusing on collaborate on research and development of new technologies. That's kind of their main focus. So it kind of leads to also the strong finance metrics become their strength also because it shows indication of a strong market of mergers and acquisition in medtech sector, particularly in the medical field. Because it can see a great potential with the leads up to a trend of improvement for market capitalization. Because medtech company are seeking their market capital its increase, that's also tend to lead to an increase in share prices. There are going to be a lot of initiative within the healthcare reform bill because there needs to be identified the needs for the new entry of the treatments. Greater impact for the new devices is mean more presentative technologies and also more increased home care. And that's conclusion to the strength lead to the strong demand for the emerging market, which is kind of good way for the company and also the overall of the industry. But since I talk about the strength, I want to move on to the weaknesses. So focusing first on the medical device tax, in 2013, the U.S. implemented a 2.3 exercise tax on sale of medical device, which means this tax leads to some of the layoff and also decrease in R&D. And this device tax can also negatively put the U.S. company at a disadvantage against foreign competitors. And talking about the higher tax rate also reduce companies' resources for capital investments, clinical trials, to as manufacturing improvements. And as you can see, a regulator environment is also important. The increase of regulation lead to increased costs associated with the development of products. And foreign regulation also cause difficulty because they add additional layers of difficulties. So you can see some countries like China have regulation that favor domestic manufacturer because they want to support and kind of cut out not the middleman, but kind of all the costs, everything. And the final point I want to show in weaknesses that the medical device industry often faces a very long time to market for their products because there's a complex purchasing environment, pricing gaps, and government influences. All of these factors affect how the investor will. So put the money in this market is kind of hard, but it's also a lot of potential to do so. So now I want to move on to Finn about opportunity and threats.
Yeah, thank you, Nathan. I will start with opportunity first. Well, the opportunity that I would like to speak is the first thing it should be because right now, like the market is so big, like what Rupa has said before. So what I want to say is the opportunity right now is going to be a lot especially in emerging region countries such as in Asian country and also the Eastern Europe country. As you know, like at this time the Tricol opened like only 4 branches in Asia, so there's still a lot of market that they can entry and to gain a lot of benefit from there. And like what Rupa said before, that it still have a lot of opportunity with right now it's 2.7 billion in 2016, and they expect that in 2024, the market going to increase through 4.5 billion US dollar. So this is the first one that I would like to say, and I would like to focus on that there are still many countries that this company can go and operate in. And the second thing that I would like to mention is that technology and innovation are always developed, which means there are always, a new opportunity or a new products available in the market. So this is a really good thing, and also the innovation and a lot of things. And lastly, for opportunity that I would like to say is finding a new partner, and like maybe currently Tricol operate and coordinate with the military base and in the product of medical. So if they can find a new partner in other countries, this could be a really good opportunity for them. Especially they might get a budget and then to invest, and then they get a new product they sell to the military, and also they can sell in the market. So another thing that I would like to say about the threat is the first one is the cyber security. This one is really important in nowadays. As you can see, there are so many, many guys want to, use the internet and then access to your company and still your privacy, still your important information. So this is kind of like growing concern with the hacking attempt. So they must be really carefully to protect that information and to create like a security system. Technology and innovation must be updated. If not, or other competitors gain more benefit, the company can lose. The second thing is the product commoditization. Because medical advice are becoming more portable, it may be easier for offshore competitors to bring similar products to the market faster or at lower price. So US companies will need to ensure that their products are differentiated in order to demand premium pricing. And as what I say, the opportunity is a lot of countries that still have a high demand for the Tricol products. However, Japan and China are the second and the third respective medical device market. Why this market are also opportunity? The different regulation and a lot of requirements. So this might be a really big issue for the Tricol to understand the culture different, the regulation different, and also a lot of requirements. And lastly is managing patent and key employees. This is also important because this company relying on the key employees that good innovator. So if the key employee they lost them, and then these employees go to other companies, that might affect for their performance and also their competitors' performance. And the next topic that I would like to speak is the defighting from research. Well, in annual logistic cost for pharmaceutical and medical device company is 6% of sales. Approximately 85% of distribution center are company owned. Finished goods inventory turn is on average 10.9 for the industry. So this is important. Of the total supply chain headcount, on average, 46% of employment is for logistics. And next, Nathan gonna speak more.
Oh, okay. So I want to add some more about some key finding that focusing on increase in FDA regulation. So from 2010 to 2014, there has been increase in from around 483 warning issue from defiances against CFR 8220.50. And then also there are some regulation toward each quoted each manufacturer share, establish and maintain procedures to ensure that all purchase or other received product and services conform to specific requirements. And also lastly, citation of this regulation have increased 25% of the past 5 years. And now we want to move on to recommendation from the research to Rupa.
Yeah, so just a quick note on what Nathan was just saying. So that regulation that is been increased by 25%. Basically, the intent of it was to ensure that manufacturers only select only suppliers, contractors, and consultants who have the capability to provide quality products and services. So a big thing that the FDA is regulating is quality assurance regarding these products. So our first recommendations that we researched come kind of directly from the FDA. So there's a few things that are suggested. One is that companies should ensure that suppliers are performing adequate and appropriate validation studies. Additionally, the manufacturer shouldn't be assuming that all specifications have been tested or inspected by the suppliers. Therefore, it's important that they themselves inspect critical to quality attributes. And also, implementing methods that can accomplish document oversight are also really important. For example, balanced scorecards. And the data that's collected about the suppliers needs to be consistent and reliable, because medical companies really need real-time data and not just like monthly check-ins. So the next slide that we have is just a couple warning signs that supplier quality might be failing in the supply chain. So one of them is a rising number of falling parts per lot, and this is because in the medical device industry, it's really important that companies measure suppliers' depth and manage the non-conformance as effectively as possible, because failing to identify, evaluate, or correct quality issues can increase costs, prolong product delays, and threaten consumer safety. Additionally, the progression of missing ship dates can also be an indicator. A progression of missing ship dates can indicate that a failing manufacturing process that is affecting the supplier's quality. If this is occurring, it's important not necessarily to break off the connection, but to determine the root cause. And setting clear requirements and expectations up front for the supplier is really important. And the last thing that we researched was potential benefits from logistics outsourcing. So one benefit of doing that would be to eliminate the middleman. One potential solution for a medical company to have a competitive edge is to go straight to medical providers instead of working through distributors. Because of the advancement in global communication, medical device companies have the opportunity to take more direct control and eliminate the distributor. However, in order to do so, it would most likely utilize a third-party logistics provider. Outsourcing would also potentially allow for relocating distribution to accommodate growth. So outsourcing logistics can free up facility space for expansion. So if a company moves finished goods distribution from the plant, the newly free space can be utilized for expanded manufacturing operations. Additionally, if the distribution centers from which they're then being shipped out from are in metropolitan or really well-populated areas, it can reduce the cost of transportation. And the last point that we have about potentially outsourcing logistics would be that they could help with meeting stringent regulatory requirements. So as we've mentioned throughout the whole presentation, that the regulatory environment is pretty unpredictable. It's not only state by state in the United States, but it's also across all the different countries that the supply chain may be reaching. So third-party logistics providers could potentially help with this as well. One example that we came across was a sensor-based logistics technology for critical shipments called SensorWare that FedEx has. So basically what that is a small device of sensors that's placed on the box or on the pallet or any other shipment location for the product. And during the transit, the device is continuously communicating critical information. This information can include location or temperature or pressure, barometric pressure or light exposure, all of which can influence the devices. This particular technology has been approved by the FDA, the FCC, and the FAA, so it's pretty interesting. So those are the three things that could be potential benefits of logistics outsourcing, and that's all we have. You guys have anything to say?
Yeah, I do totally agree with you. With
agree on.
like potential benefit of logistic outsourcing, because it's gonna, like really benefit for the company in case if they do only themselves, that's not might be good. Yeah.
Yeah, I mean,
You understand?
Oh yeah,
Yes.
yes.
Yeah, like finding the expertise party will be help, right? Yeah.
All right. Well, I think that's it.
All right.
Okay.
Thank you.